The president once again altered the course of Obamacare, putting off the employer mandate for another year. How can one man operate so cavalierly above the law? We spoke earlier with fed-up Wyoming Senator John Barrasso. Take a look.
The president has now, 24 times decided that he could change the law on his own whim, unilaterally. I think he's doing it because he realizes how badly his own health care law is hurting the economy. He ought to work with Congress to get up with ways that we can relieve this huge burden on the American public. In this latest delay, Monday, that is supposed to, quote, smooth the transition for businesses, isn't helping people at all at home, middle-class workers. The individual mandate still applies to them. They still have to prove to the federal government, to the IRS, that they have health insurance this year.
And so what are you doing in the wake of this latest adjustment that the president is making, putting off the employer mandate? What are you doing to try and attempt the same with the individual mandate?
Well, I've called for the president to actually eliminate the individual mandate. That's the one that the American people are so offended by. And I will predict that after this enrollment period ends on at the end of March, I wouldn't be surprised if the president actually pushes back the individual mandate. If he did it now, there'd be no reason that people would sign up at all. I think they'd see their numbers drop way off. But I think the president recognizes this health care law is hurting the economy. We see it in the CBO report that came out from the Budget Office of Congress last week. We see it in jobs numbers. And I think the most important thing is to now eliminate the individual mandate, which is unpopular and burdensome for American people.
Well, Senator, obviously there are a number of Americans who are pretty displeased with the rollout of the Affordable Care Act and the implementation and all of the various changes that have happened. But they're also pretty confused about what conservatives actually have on offer as an alternative. But surely you wouldn't advocate for the status quo. What do you recommend we do at this point?
Well, I have a framework of things that we ought to do. One is we need to make sure that people with pre-existing conditions can still get coverage. My wife is a breast cancer survivor. She's been through 3 operations, chemotherapy twice. As a doctor as well as a husband, I know how important it is to take care of people with pre-existing conditions. There are things that actually can address the cost of care, making it more effective and efficient for people to actually purchase insurance cheaper, more affordable. And the things like that are allowing people to, small businesses, to join together collectively to get better deals on buying insurance, let people shop in other states to buy insurance across state lines. And I think that people that end up buying insurance individually ought to have the right to have the same tax advantages that the businesses get in a way that it levels the playing field so it doesn't penalize people who buy their health insurance and don't get it through work.
And Senator, wouldn't an exception for pre-existing conditions, however, actually increase the cost of care as well? If people can buy insurance after they've already gotten sick and they can do so perpetually, wouldn't that create all sorts of bad incentives in the market?
Well, I think that's why what we've done with our state insurance high-risk pool in Wyoming, when I was a member of the state legislature there, which was a successful program, it didn't distort the insurance market because it just focused specifically on individuals with pre-existing conditions. There was a subsidy for that from the state, but also those people did pay a bit of a higher premium. So there was a combination of a subsidy as well as a higher premium. But those people had an opportunity to buy that insurance and then have it. There's a limited enrollment period, but you can't wait till after you get sick to buy the insurance, which is what the president's plan allows now.
Senator, just jumping off of both Kennedy and Camille's question, and I talk to people about this all the time, about the individual mandate and about health care reform here in New York City and outside. And, I have to stress the same thing again, is that what people don't understand is what the alternative is, what the alternative to Obamacare. We are saddled with this, correct? I mean, this is the idea that people have. I mean, Obama's doing things, making it very unpopular, moving the goalposts all the time, correct? Where are we now? Are we saddled with this? I mean, what is the Republican alternative? And you said that to Camille, but how likely are we going to see something change dramatically in the next, say, 2 years?
Sure. This is the first time in the history of our country that major legislation was passed on single-party line votes. Not a single Republican voted for this health care law. The founding fathers set up the way that the system works here so that people would work together, Republicans and Democrats. But when the Democrats got to their 60 votes in the Senate, they said, hey, we're going to do it our way. They rejected ideas that I think would have had buy-in from Republicans, so they would have had more of an effort to make sure something worked if it was something all of us believed in and had bipartisan support for. So that's where the president, I think, went wrong, and why we ought to work together to replace this with a system that actually focused on what the president said the #1 concern was, which was the cost of care. And in fact, what he did, he twisted away from that and worked toward giving more people coverage, but coverage doesn't equal affordable care. And I think that's the bind that we find ourselves in now because of the way the president approached this and ignored input from the Republicans.